What I'd like to do is provide you all with an overview of the Department of Community Services, which is our safety net for struggling families in St. Charles Parish. And so I try to give it a different bit of information every year. Last year, you remember we talked about some of the reports from United Way. Well, this year, I want to give you a little bit of information from our annual assessment process that we have to do to determine client needs. And this is part of our grant requirements, that we keep a pulse on the community, and we look at a variety of sources to do that. In St. Charles Parish, I looked at certain indicators, and we are known as the Parish of Plenty. However, in the Parish of Plenty, we have pockets of poverty and low-income individuals who come to us for services throughout the year. And it was kind of surprising that that poverty level has creeped up a little bit to 12.1%. I believe a couple of years ago when I came here, it was hovering around 10 or 11%. So we are seeing an increase in the number of families living in poverty. Now remember, that's adjusted every year based on the federal guidelines for poverty level. A correlation between the typical client that we see in our office and those indicators from the census data and the data from the Community Action Network shows that we have about right at 6% of female households living in poverty, and that is the typical profile of single parent females coming to us, the predominant group that's coming to us. In addition, we have about 8% families in poverty in this parish, and that's kind of on that line of not just poverty, but working families who are underemployed, or that asset-limited, income-constrained category of individuals. And it correlates with the type of individuals who come to us for services throughout the year. Every time clients come in, we do a variety of gather a variety of data from them directly, because who better can tell us what their needs are than our clients? And so we asked them this year to complete a survey ranking their needs, not just what we can do, but in general, what are their needs? And then in addition, we compiled that with our intake data. That's when we do a client interview with everybody who comes in the door, who you are, profile data, but also what did they come for and what else could we help them with. And so the top categories that came out from those two sources of information are, number one, food insecurity, and it kind of correlates with our increase in the need for monthly food distribution in St. Charles Parish. And we see that with our community partners working in other food banks throughout the parish. Emergency financial support, that comes in a variety of ways, but predominantly utility assistance. Financial management and family budgeting, individuals asking us to help them to learn how to manage their limited resources. And very often those are individuals on fixed incomes, and it's getting to be harder and harder to do that, as we all know. Life skills covers a broad category of areas that we can help individuals, and that could be everything from that budgeting, but it also could be job readiness and life management, family-related issues, parenting, things like that. Job opportunities will always be up there. But another one that's emerging, and we're seeing that as well with the requests that we get in our office, is affordable housing. We have a very limited stock of affordable housing in St. Charles Parish. If you look at who's coming to us for assistance, well, we've had this year about 1,160 families coming to us for emergency assistance. Of that, about 26% had never been to us before. Those are the individuals who maybe live paycheck to paycheck. One thing blows and they're not able to meet their monthly bills. For example, how many people have had a car repaired recently? Something like that. At $500, if you bring a car in a shop, it's $500. That could be almost the entire monthly income of some of our clients. If you look at the split of the people that we're serving, it's pretty well balanced based on the population data. For St. Charles Parish, about half, few more on the East Bank, coming from the East Bank, but pretty much half and half, and pretty well corresponds to the population within each area within St. Charles Parish in each one of those communities. I want to talk a little bit about economic impact. You know, and this year we're looking at budgets, and the federal government is talking about budgets. And so I did a little quick math. You know, I've never really added up all the programs and everything. Then that would be the federal dollars that come to us, as well as some of the local dollars and special programs from private sources. So, for example, our federal, and these are direct dollars that assist a family. It's pretty much passed through our department. We manage that, and it goes right directly to assisting these individuals. So 710 families benefited from $265,000, well, almost $266,000 in direct energy assistance. And then we have another pot of money from that LAHEAP for people who are in crisis, and very specific to that crisis, another $21,000 there. And Atmos has provided us with direct access to a database that they put virtual money, I guess you could say, that we can pay bills on behalf of clients who come to us in need of assistance, and we can put a credit on their account using that pot of money that they allocate to us. And we've done about $9,000 in direct assistance there. In addition, you know, we have the local funds, local emergency assistance, which includes our partnership with Second Harvest to provide a food bank, but we also have some local food that we purchase or we get donated from special events in the parish. And so we've given out 341 boxes of food. We've served another 116 families just with emergency assistance. It could be medicine. It's a little more flexible because those are local funds. It allows us to provide a prescription for an elderly person, for example, that wouldn't be covered, or a water bill. We do a lot of water bills these days. And so we also provide shelter, and our shelter is 2 nights in the Ramada till we figure something out and try to help link them with other resources. And we have a little bit provided to us from our CSBG funding in that direct category. In addition, we did about 240 Thanksgiving baskets. That has grown from, I want to say, 50 baskets we gave out 5 years ago when I came into the department. We're up to 240. So again, it correlates with that trend that we're seeing in St. Charles Parish of food insecurity. We run 2 center programs, and this, again, has grown significantly over the past few years. We opened up our center in Killona, and we have 2 major programs out of there. The after-school drop-in. During the school year, we do extended hours, so individuals can come there, they can get homework help, they can get a snack, they have a safe haven, they can have some productive activities. We do some fun things with them as well, but it's sort of a balanced curriculum to offer kids that safety zone for them in their own neighborhood. During the summer, we've had 315 kids dropped in between Killona and St. Rose. I combined the data this year. So some kids may have come a few times. Maybe they needed help with a school project or homework, or came for a special program that we offered targeting youth. We have the summer enrichment programs, which provides them with 6 weeks of structured activities. A portion of that helps them to retain their academic skill level that they've come out of school with, and you know, not get too rusty by the time school starts again. We also combine it with the summer food program, where they go and have a healthy meal, and then they come back and do the fun activities in the afternoon. And so we are at capacity with both of those programs, running at 86 over the 2 sites. Throughout the year, we've given out almost 4,000 snacks after school. The kids come out of school, and I think sometimes they get a very early lunch in school, and after school they are looking for a snack. And then we've been able to offer over 60 special programs, and that would be a guest coming in, or some of our life skills events as well, like cooking on a budget, for example, things like that. So we've tried to be creative with that programming, and again, in response to the needs identified in our assessment process, so that we're offering, and the more we offer, and we're seeing that link, you know, we're offering programs that are related to the needs very often we'll get high participation because of that as well. We have a home repair component, and that encompasses 3 areas. One is health and safety. That's local dollars that we've stretched using our one carpenter that works part-time, and we supplement that with volunteer groups that come in. And this year, we've done over 43 projects. And that could be anything from replacing a window unit or repairing an air conditioning, not replacing it, but repairing a regular window unit, a full unit, or doing things like a water heater or putting in handicap bars. In addition, United Way, and this has grown significantly, they give us money allocated for ramps in St. Charles Parish, and ramps are pretty expensive to build because you have to do it to code. And we've grown that program. It's a partnership with Volunteers of America, and we've grown it to now, this year, 79,000. I think 5 years ago it was about 15,000 that we did there.
Excuse me not to interrupt you, but you're getting close.
Okay, I got 2 more. I'm sorry, I get too much info. And we help in other projects with the federal dollars. Summer feeding, I think you're familiar with that. 3 sites, 8,000 meals this year. Again, food insecurity. Special program initiatives, we offer life skills, the youth rally, mortgage assistance, and we do everything. We've been building the program capacity, on my last slide, Mr. Chair, through a variety of public-private partnerships with our vital partners throughout the community. And so now what we have in St. Charles Parish is a continuum of care where we share resources, refer clients, so we don't duplicate effort. And I'll entertain any questions with my half a minute left. Thank you.
Okay, thank you, Ms. Diaz.